to this pandemic. Evidence shows that older people are at particularly high risk in emergencies. This evidence, the research and data, but most importantly, the daily struggles for older people that have been sometimes ignored. In some instances, they have been dismissed, and in some situations, treated with indifference. Neither of those realities solve the problem, a problem that we have been aware for too long. One thing that struck me from the research that we will be sharing today is that our responses to older people's challenges have not changed in 20 years. And I have many questions to understand the why, as I know the audience does as well. But as the title of the panel says, we want to understand how to take this evidence and knowledge into practice. It is with great, and I'm very excited about this panel because we have excellent and diverse panelists that will guide us through, and together we're aiming to have an honest and candid conversation with the objective of, first of all, presenting the key trends and evidence in relation to older people's experiences in crisis. Secondly, understand how blanket approaches to humanitarian assistance are failing. Thirdly, and from my perspective, the most important one, encourage all of us to support inclusive approaches on humanitarian assistance. We will do this today by first listening to 3 speakers from HelpAge International, Amnesty International, and ODI. Each of them will have 10 minutes for a presentation. We will then have 3 respondents from the German Ministry of Foreign Affairs, the British Red Cross, and Christian Aid. Each of them will have 5 minutes. And finally, we will open the floor to our audience. Thank you all for being here. I am pleased to introduce our first panelist, Verity McGivern. She is a humanitarian advocacy advisor at HelpAge International, where she leads research, policy, and advocacy work to strengthen the inclusion of older people in humanitarian responses and ensure their rights are being upheld. Verity, the floor is yours.
Thank you, Miriam. I'm just sharing my presentation, so hopefully that will be visible to everybody shortly. I'll just give it a second. Okay, there it is. Okay, good afternoon, everyone. So as Miriam said, I'm going to kick us off today presenting some research that we launched recently with Age International. That highlights the underlying challenges and barriers that older people are facing accessing humanitarian assistance. And the report that we released is called If Not Now, When? So the numbers of older people affected by humanitarian crises, has already been said, are large and growing rapidly. And evidence from multiple disasters shows that older people are at particularly high risk in emergencies. And there's been many commitments that have been made in recent years to protect the rights of older people to access humanitarian assistance in keeping with humanitarian principles and provisions in international law. But despite this, older people continue to be neglected in humanitarian response. And unfortunately, the humanitarian community is really failing by the standards that it set itself. And with COVID-19 and the disproportionate impact that we see on older people, it's really important that we address this more urgently than ever. So the report, just to give you some background, draws on the findings of needs assessments that were carried out by HelpAge in the 13 months to the end of 2019. And in total, we interviewed nearly 9,000 older people. And they were people affected by natural disasters, conflict and socioeconomic crises in 11 countries in Africa, Asia, Latin America and in the Middle East. And the compiled data forms the broadest ever survey into the situation of older people affected by humanitarian crises. So what did we find out? Firstly, that older people's basic needs are being unmet. So here's just some key findings. 64% didn't have enough to eat, 77% had no income, 20% no access to shelter, 25% no access to safe drinking water, and 62% no access to bathing facilities. We also found that the impact of crises, coupled with the lack of available support, is doing really serious damage to older people's mental health and well-being. And fewer than 1 in 5 of the people that we spoke to said that they felt able to cope independently and without support. And that was actually only 13% for those aged 80 or over, so getting worse as people increase in age. And the data also showed that the situation was consistently worse for women. To provide humanitarian assistance, as we know, the first step is to find out what people need. However, our research also shows that older people are rarely consulted and are often excluded from data collection and analysis, so their needs remain unknown. And more than 3/4 of older people said that they had not been asked by any other humanitarian agency about the services being provided to them. And we compared that finding from the needs assessments carried out in the first 6 weeks of an emergency with those conducted during protracted crises, and there was actually little difference. We were just trying to see whether there was just a lag and the assessments were perhaps happening later. But actually, in some protracted crises where aid agencies have been working for several years, the needs assessments found that the proportion of older people who said they hadn't been consulted was actually higher. So 93% in Zatri camp in Jordan, which has been hosting refugees since 2012, 85% in northeast Syria, where there's been an ongoing conflict for years, and 97% in Venezuela, where again the crisis has been going on for several years. Older people are also missing from the data that's been collected. We reviewed the humanitarian needs overviews and response plans for the 11 countries covered, and age disaggregated data for older people was included in only 3. And given the lack of data on older people, what we're finding is that aid workers are often relying on assumptions. However, our findings show that there's often a mismatch between these and the reality, which is causing problems for older people. So first off, an assumption that all older people live with their families. Actually, a lot of older people are living alone. It's 20% across the whole sample and 24% of refugees and IDPs. Secondly, an assumption that families are the best source of support for older people, and if you can access the family, then you've accessed the older person. One thing that we have found is that humanitarian responses are increasing older people's dependence on others. And data from the assessments clearly shows that older people are experiencing really high levels of dependence on their families and others to meet their needs. And the proportion of older people saying that they depended on their family and friends was actually lower in assessments done in the first 6 weeks of a response than in protracted crises, which suggests that dependence actually could be increasing over time, and that the response might be failing to support older people to maintain resilience. And that's significant because we know that practices that increase older people's dependence on others are likely to increase their risk of being subjected to violence, abuse and neglect. And they also undermine older people's autonomy and independence. And we know from previous research that older people's ability to rely on family and community diminishes over time. And then thirdly, another assumption that older people are kind of beneficiaries of aid and kind of net beneficiaries and not contributing to their families and communities. And the reality is that older people are playing really significant roles, particularly as carers. Nearly 2/3 of those we interviewed said they were caring for at least one child, and 1 in 6 older people were caring for more than 5 children. And many older people are also caring for other adults, including spouses, adult children, and even parents of their own. Older people are also playing other roles in communities, and here's a quote from Cholpur, who leads an older people's association in a refugee camp in Ethiopia, and the members there are monitoring the situation of older people in the camps. They're visiting those who are unable to leave their homes and flagging up issues with camp authorities and aid providers. So our findings also show that blanket approaches to delivering humanitarian aid prevent older people from accessing even the general services that are available. We found poor access to healthcare, despite 98% of older people reporting at least one health condition, a quarter unable to access health services, and half said that there was no medicine available to them and that health services were too expensive. We also found little support for those with disabilities, despite 40% of older people having at least one disability. And only a minority of people identified as having a disability said they had access to an appropriate assistive device. Older people with disabilities are faring worse overall, compared with older people in general in the sample. Fewer had access to health services, more were reliant on family and friends, and more were unable to reach distribution points. I think what's important to say is that the findings for this report really reflect a long-standing neglect of older people in humanitarian crises. And what was really striking is that while these findings are, they're very clear, they're very moving in a way, there's huge numbers that we're talking about. When we look back at the findings of research that HelpAge did some 20 years ago, when we were sort of starting out in humanitarian response, a lot of the issues and a lot of the challenges that older people were highlighting at the time are the same issues that are coming up in this research here. So it's really a question of now being the time that we need to make a change. What we're finding is that too often addressing the needs of older people is considered an activity for specialist agencies. So it's great to see so many mainstream agencies here in the kind of virtual room with us. We find that older people are typically overlooked in favour of larger, more visible population groups, and also that faced with, a huge humanitarian need that's outstripping available funding, aid agencies are having to resort to this one-size-fits-all programming that can be delivered at scale, but then doesn't account for the kind of different needs that older people might face. We've also found that organisations are reluctant to add another mainstreaming lens to their work, given the existing pressure. And one person interviewed for the report told us that there's just no more room for a box for another vulnerable group. Older people have waited long enough now, and the COVID-19 pandemic has exposed the gulf between the risks that they're facing and the support available to them. So it really is important now that we come to some steps forward, I think. So it's really great to see so many people in the room, and I'm hoping that we can have a good conversation today about what some of the challenges are and how we can move forward together as a community. Just to give some thoughts on the way forward very quickly, because I know I need to wrap up. We're calling on the humanitarian community to stand in solidarity with older people and put 4 recommendations into practice. One is showing leadership, which includes including older people in funding guidelines, criteria and programme portfolios, advocating for their rights within the international humanitarian system, and investing in capacity building and designating focal points so you have some leadership internally. Mainstreaming older people's inclusion, so integrating age into existing gender, disability and protection mainstreaming policies and action plans that many agencies have in place. Incorporating the humanitarian inclusion standards into policy, guidelines and training, and investing in programming that upholds older people's rights and meets their specific needs. Strengthening data collection and analysis, so routinely collecting, analysing and using data on age, sex and disability. And that includes interviewing older people directly as part of needs assessments. It also includes requiring funding proposals and reporting to include some specific analysis of the risks older people are facing and the support that they're receiving. And then finally, just to conclude, just really fundamental is consulting older people, and all humanitarian actors must meaningfully consult older people and promote their participation and empowerment. And that requires investing in programming that gives older people a stronger voice in responses, provides accessible methods for them to feed back on assistance, and also mechanisms for adapting programs according to that data analysis and feedback. I will stop there. Sorry that I had to have my camera off for that. I think my connection was a bit unstable, but I'm looking forward to the discussion later today. Thank you, Miriam.
Thank you, Verity. The report that you have, if not now when, is a call to action to the humanitarian sector to prioritize and implement sustainable solutions for older people's rights. So thank you for that. Our second panelist is Matt Wells. He's the Deputy Director in the Crisis Response Program at Amnesty International, where he leads work on the specific impact of human rights crisis on children, women, persons with disabilities, and older people. His work at Amnesty International has included investigations on the impact of conflict and displacement on older people, women, and men in Northeast Nigeria and across Myanmar. Matt, thank you for being here. We're keen to listen to your presentation.
Thank you. Thank you so much, Miriam, and thanks, Verity. And just to say at the outset that there's going to be lots of overlap, which is perhaps not surprising, between the points that I'll raise and what Verity has just talked about, as of the wonderful quantitative work that they've done across many context fits very closely with what we have found in our qualitative work in Northeast Nigeria and Myanmar and elsewhere. To start, I want to actually back up a bit before talking about humanitarian response to talk very briefly about the experience of conflict itself, because I think that's essential in understanding what many older women and men are facing at the time that then they later encounter humanitarian actors in places like Northeast Nigeria or Myanmar. I'm going to focus mostly today on the recent work we did in Northeast Nigeria. It was a report that came out in December last year, but I'm happy also in the question and answer to talk about some of the other situations that we've looked at. And I think one of the key things is that I think there is historically been an assumption, and it's certainly one I think that I had and that others at Amnesty have had over time, is that older people, while certainly facing human rights violations and situations of armed conflict, were perhaps more likely to be spared or less likely to face the sort of egregious violations that we document for other populations. And in the course of really starting to focus on the impact of conflict on older people in the last couple of years, we've seen quite clearly that that's not the case. That while, for example, in Northeast Nigeria, there might be, I'd say, a lower risk during any individual attack carried out by, for example, Boko Haram, that the specific experience of older people in these places leads to different sorts of risks that accumulate over time and that are different from those faced by many other parts of the population. So, for example, older people we found are disproportionately likely to live in areas that are controlled by Boko Haram or where Boko Haram has an active sort of influence, in part because older people either may, because of very deep ties to home and land and having worked the land in a village for 50, 60 years, may be less willing to flee than other parts of a population, or at times because of reduced mobility may be unable to flee, that they were disproportionately represented in these areas that Boko Haram has active influence, and that over time that meant that they faced a variety of unique risks compared to other parts of the population. So they're routinely hit for attacks or have their cattle stolen by Boko Haram and are killed if they refuse. There are restrictions on older women's movements and livelihoods, ability to go out to work farmland, for example. And together this means that they often face really acute situations of food insecurity. We documented a number of older people who died from starvation or starvation-related illness linked to the fact that they couldn't access sufficient food in their village. Many of them have also witnessed the murder or abduction of children or grandchildren or other members of the family. And so often, in addition to the trauma that they themselves have faced directly, have often been witnesses to atrocities against, again, children or grandchildren. And then on the flip side, we found that when the Nigerian military then undertakes operations in Boko Haram controlled areas, generally they come into villages and they open fire indiscriminately. And overwhelmingly, it's older people or persons with disabilities who have been left behind in the village or who remain behind in the village and oftentimes have been shot and killed or seriously injured during these indiscriminate attacks on villages. And so over time, again, because of the fact that they're disproportionately represented in areas where active fighting is taking place, they face this accumulation of risks that tends to be unique to older women and men in particular. And finally, before I turn to the humanitarian response, I mean, one of the, I think, particular and somewhat unique aspects that came out in our work in Northeast Nigeria is the extent to which older men in particular have been unlawfully detained when they then try to flee Boko Haram controlled areas to government controlled areas. We documented a number of cases in it. I mean, the scale suggests hundreds, if not thousands, of older men who have been detained over the course of the conflict for between months to up to 4, 5, 6 years without ever facing trial, without ever facing any sort of charges even. And that they died at enormously disproportionate rates in detention, where in detention sites in Northeast Nigeria, typically military barracks, there is severe overcrowding, extreme heat, little water or food provided, appalling sanitation. And according to people we spoke with who work at the morgue, or who have worked directly in some of the detention facilities, older men comprise somewhere between 15 to 25% of those who have died in detention, while only being around 4% of the population in the Northeast. So all to say that, I think key to understanding then what comes with the humanitarian response is that they have often faced atrocities in conflict settings. And, well beyond the work in Northeast Nigeria, we've seen similarly in Myanmar with the Rohingya crisis, where mortality surveys showed that older people were killed at least 3 times the rate of other parts of the population. There's been similar data that's come out of South Sudan. And so I think, again, critical to understanding the experience in displacement sites is that they have often suffered disproportionately from the conflict itself. Now, in terms of the humanitarian response, and again, much of what I'll say will echo Verity. I think the kind of 4 biggest things to highlight, and the one that's, I think, core to all of this and that relates to everything else is, as Verity said, the fact that older people are typically ignored or excluded in assessments that are undertaken. This is both in the way that data is collected. Oftentimes in Northeast Nigeria, for example, it's done through key informant interviews, which generally means speaking with community leaders, speaking with youth, at times organizing focus groups of women. But all of this tends to leave out older people and older women in particular. I interviewed around, it was 133 older people in Northeast Nigeria, of which about 65 were older women, and almost none of them had ever been interviewed in any way by a humanitarian organization. They had never been, part of any assessments or any sort of attempt to understand the situation that older people are living in displacement. And so that then affects everything that comes after in terms of understanding the challenges, the specific challenges that they're facing in displacement and the types of assistance that they need. We also found that there was very limited, almost no targeted assistance to older people in particular in Northeast Nigeria. There were some distributions done targeting persons with disabilities that occasionally reached some older persons with disabilities, that was generally just severe physical disability as opposed to other types. And so again, there tends to be exclusion of older people in a failure to have any sort of targeted intervention to meet their needs. As Verity said, the number one thing that came up in our interviews related to assistance were challenges with food assistance. Now, the context in Northeast Nigeria is incredibly difficult across the board. We've seen, just in the last couple of months, attacks on aid workers and the destruction of property and places that humanitarians use to house assistance. So it's an incredibly challenging environment, but one in which, even despite the challenges, the way that assistance is set up often marginalizes older people who may have difficulties, for example, in their words, fighting with younger people in lines or waiting in queues for long periods. Those with physical disabilities may have challenges to reach distribution sites in the first place, and very rarely here or in the context in Myanmar where I've worked have there been community workers who will go shelter to shelter to both to assess needs or to provide assistance when someone can't get to a centralized site. And the other thing that came up in terms of food is that older people appear disproportionately likely to be left off distribution lists in the first place, or to be on a list, but then have problems. Say there's a changeover from one system to another, and for a variety of reasons, they don't get reached in the changeover system, and so then they're left off of food. So we interviewed a number, again, of older women in particular who weren't receiving any assistance at all, even despite living in an IDP camp, and who didn't know how to resolve the problem, or who had tried to resolve the problem but had been unable to over a period of often months up to a year. And so then we're forced to beg, or as Verity also talked about, where we're forced to rely on family members and others, putting them in a position of even more vulnerability. The next issue that comes up a lot in the context where we work relates to health, and Verity touched on this as well. But I mean, I think one of the core things is that in these locations, the humanitarian response has not met the needs of older people in terms of this specific chronic illness that they are disproportionately likely to face. So, for example, things like hypertension, diabetes, chronic pulmonary conditions, those in most of the clinics that are operating in these places have not been part of the medical response. And so the result is that older people are generally forced to purchase these medications for themselves, which often means selling part of their food ration, or more often just going without. And so, interviewed a number of people who had hypertension and were unable to access medication for it because it wasn't provided in the camp clinics, and they didn't have the ability to purchase it themselves. And that again relates back to often having difficulties in having access to livelihoods that other parts of the population may have, even in displacement. And so in terms of key recommendations or key things that we're pushing that come out of our research, and again, often echo a lot of what Verity has said, a real need for better disaggregation of data. And I think this is seen, for example, in the fact that in at least in the places where we have worked, there is a range from 18 to 59 years old, and then from 60 plus. And we think it would be far better to break this down by 10-year increments, both to capture, for example, 50 to 59, which in many of these places, like Northeast Nigeria or in Rakhine State, Myanmar, are considered by the population itself very often to encompass older age. And so by lumping that 50 to 59 from 18 to 59, there's a missing of a lot of challenges that part of the population is facing, but then also to disaggregate 60 to 69, 70 to 79, and 80 and above, because the experience and needs are very different in those different 10-year increments. Another is in this, again,
sorry, Matt.
echoes very, yes.
If you can just summarize that in 1 minute, because we are running out of time. Thank you.
No problem. Yeah, I'm down to the last minute. Is the need to not see older people as homogenous, and the fact that many older people are living alone, many older people are heading households, taking care of children and grandchildren, and there is a need, I think, to track this specifically, to seek out this information specifically, because the response to those parts of the older population will often have very specific needs. And then lastly, just the essential need to be inclusive in all aspects of this, from the donor side, to be inclusive in funding and be inclusive in ensuring that programs that are being funded are reporting back on the response to older people in particular, and that agencies and NGOs that are implementing these assistance programs are always being inclusive in the design and evaluation, and that including, as Verity also said, speaking with older people to understand their needs, but also to understand how assistance is and is not reaching them and falls short. Thank you.
Thank you, Matt. It is shocking to realize the violations of older people's rights, their suffering, and how humanitarian responses have failed to be accountable to older people. I will now invite Veronique Barbalet. She's a senior research fellow at the Humanitarian Policy Group at ODI. She's a political scientist by training with a particular interest in humanitarian policy, humanitarian negotiations with armed non-state actors, conflict and security, protection, gender-based violence, and livelihoods. Veronique, we're very excited to hear more about your research and finding.
Thank you very much. And as the two previous speakers have said, or as Matt has said, I will also repeat some of what Verity and Matt have said. I think there's a very clear trend in the evidence. So a couple of years ago, I conducted a study with HelpAge on the inclusion of older people in two crises in East Africa, the response to the 2016 drought and response to displacement caused by the conflict in South Sudan. Both of these studies looked at the roles, capacities, as well as vulnerabilities of older people. And the studies also examined the informal and formal mechanisms that responded to the crisis. Today, I'll present some highlights from the study on older people in displacement and the challenges that we identified and some of the opportunities as well that exist to support the inclusion of older people in humanitarian responses. So what did we found? So we found that the roles of older South Sudanese displaced people that we were studying, both men and women, changed during displacement. And that's important in understanding, again, a bit like what Matt was saying, it's important to understand how these shocks and crises are impacting older women and men. For older women, they reported an increase in their caregiving roles, mainly linked with an increase in children being separated from their parents or becoming orphan. And then we also found that older people's traditional power and influence tended to diminish in displacement, especially for men who tended to hold these traditional positions of power. And our analysis showed that the reason for this is that older people and especially older men's authorities in their families and in their communities is very much determined by not only traditional rules and values, but also by their ownership and authority over natural and other types of resources. And with displacement, of course, it means that there's a loss of these resources, which then has a significant impact and implication for older people's role and position in the household and in the society, again, particularly for older men's power and influence, as well as access to community support. The changing roles of older people we found had two distinct impacts. So one was a very high vulnerability of older men and women to mental health issues in light of these changing roles and the changing realities for them, which often led to, we found a lot of feelings of loneliness and isolations among older people. And then the second one was the loss of access to more informal types of community-based and family-based support and assistance. And I think that's what Verity was mentioning in Emergencies, that there may be some of that loss of access to some of those assistance that could be available or were available prior to crisis. The impact of the crisis on older people, their role, capacities, and vulnerabilities was compounded by a number of other factors within the humanitarian sector. So in how the humanitarian responses were making assumptions or interacted with other people. So the first one was a lot of wrong assumptions, and Verity did point that out, and that's really interesting that it seems to be coming back. So we found a real disconnect between older people's perception of their changing roles and understanding, and then the how aid actors were understanding the roles of older people. Aid actors tended to assume that older people were cared for during displacement the same way that they would have been maybe prior to displacement, and they were not taking into account the impact of displacement on older people's social standing in their communities and in their household, as well as the impact of displacement on intergenerational relationships within family and community. So the relationship between older people and younger members of their families or the communities. The second one was that the humanitarian response compounded issues linked with older people's, or the way older people were impacted by crisis, partly because of their focus on the displaced. And that's what Matt was referring to. So many older people are left behind, either because, as Matt was saying, they're physically unable to leave their location of origins, or because they choose to stay in these locations for all the reasons that Matt highlighted. But humanitarian response tend to really focus on those people that are displaced rather than those that are left behind in their locations of origin, especially when those are often inaccessible to humanitarian organizations. And I think Matt really painted really interesting pictures and provided really strong evidence of then what happens to those older people that are left behind. The third compounding factor is that there are a lot of blind spots in programming. And again, Matt and Verity highlighted some of this, but the standard humanitarian responses that we see in crises has a lot of blind spots for older people. This is in particular on the specific nutritional needs of older people, on the need for older people to be supported with their livelihoods, especially when they increasingly are carers and heads of household, recognizing and integrating older women as often the primary carer of children, the health issue where United Health programming tends to be very, very focused on children and on pregnant and lactating mothers, and has very, very little to do with the types of health issues and chronic health issues that older people face. And then the final compounding factor is the participation of older people and their participation in the response, their participation in influencing the design of responses, in being able to give feedback, in being able to be heard through needs assessment. And part of it we found in the study on displacement from South Sudan, that this tends to be the result of an amalgamation between older people and elders, one being people over a certain age, older people, and the other one being a small subset, elders, which tend to hold traditional positions of power. And aid actors tend to think that engaging older people can be done through these elders, and often these actually do not represent the majority of older people in that community, and especially not the most marginalized, and that include also often they are male and do not represent older women. The challenges that we found in the study in terms of why the response, the humanitarian responses felt unable to include older people and their specific needs. And these were already mentioned by both Matt and Verity. One is that issue of the small proportion of older people, the fact that they're a small number, and as Verity was saying, they are not as visible as other demographic groups, notably children and women, who tend to be very visible in this crisis. The scale of needs in crisis is another challenge for the inclusion of older people. It means that often aid actors feel unable to have more nuanced programming that would take into account the specific needs of older people, and that's a big challenge for inclusion programming. The third one also mentioned by Verity, I think it was, aid actors feel very overwhelmed by these long lists of vulnerable groups that they need to consider. And older people just seem to be to them this one more added group that they need to consider. And they feel really overwhelmed and unable to do that. And then finally, as Verity was saying, there's still that feeling that older people is not the responsibility of mainstream humanitarian organizations. And this is something I've heard in my research work quite a bit, where people said it's a responsibility of HelpAge. We don't have a mandate to support older people. Well, if you're humanitarian, you have a mandate to be impartial, so you do. But that's some of the challenges. Now turning to the opportunities, from the studies that we did with the HelpAge, we found that there's some progress in the inclusion of older people, and there are some opportunities. One was that we found there is an increased recognition of the roles and capacities of older people, so not just looking at the vulnerabilities of older people. However, having said that, it's a recognition. It doesn't necessarily mean that there is the ability to act on it. At the time of the research, the gender and age marker was also seen as a real opportunity to try and support donors and humanitarian organizations to meaningfully use the marker to really think about how to include older people. The other one that we found was the role of HelpAge in mainstreaming the work for older people, and we found some really interesting work that HelpAge was doing in participating in cluster coordination at the national level and at the field level, which allowed better inclusion of older people and support to the wider humanitarian sector to include older people. And I have two more only, strategic partnerships where HelpAge was able to partner with a non-specialized organization, and that seemed to have longer term impact on their ability to do older people inclusion and to be more sensitive to the specific needs of older people and engage with them also with their capacities and in their role. And one of the things that we think is a real opportunity is to look at age-sensitive framing, so trying to think about different ages rather than thinking of older people as one group, because there are other groups where if HelpAge worked also with youth, for example, which tends to be another group that falls through the cracks of emergency responses, this could perhaps widen the advocacy and the support for more age-sensitive programming. But the one point I want to leave you with is that we really need to resolve this issue of aid actors feeling completely overwhelmed by what is quite a fragmented inclusion agenda, and to think about how to both have better inclusive humanitarian action for all, including older people, and how to make sure that we have specific programming and include the specific needs of older people as well as their role and capacities in responses. I'll stop here. Thank you very much.
Thank you, Veronique. It is so important to recognize the unique skills of older people and the roles they have within their families, but also the specific needs that they have in emergencies. With Veronique's intervention, we will transition to a more interactive part of the session, and I would like to now invite our respondents to comment on the research they have heard and to discuss the key challenges, possible solutions, and strategies that could be implemented for a more inclusive approach. I would like to first invite Pete Kohler. He's the head of Division for Humanitarian Assistance Policy, International Organizations and Multilateral Coordination at the German Federal Foreign Office. He has spent years defending and furthering human rights internationally. Pete, thanks for participating in this event. How are you addressing these challenges as a donor agency, and what obstacles do you face?
Yeah, thank you very much, Miriam, for this question. But first and foremost, hello and good afternoon to everyone. Thanks for inviting me to this very instructive exchange. I'm learning a lot. It's very interesting for us. So the question of how to include older people in humanitarian assistance is definitely a very important one to us. So how have we answered this question for us, for our humanitarian assistance being one of the biggest donors? How do we ensure that older people are integrated into our humanitarian response? But please let me at the beginning underline that what I heard, especially from Verity, is also true, or is also basically on the groundwork of what we are doing and how we are approaching humanitarian assistance for older people, especially the aspects of mainstreaming and the aspect of data. And I will explain why. So in 2018, Germany launched a gender, age, and disability marker. And the marker is intended to inform us whether a project reflects gender, age, and disability aspects. The marker also enables us to measure how projects we fund reflect these aspects and how to steer our humanitarian planning accordingly. Thereby, we can ensure that humanitarian projects funded by Germany are sensitive to the needs of older people. We expect our partners to make sure that project applications they present and reports contain specific information about how gender, age, and disability aspects are being taken into account. With regard to age, that includes age-specific aspects of older persons, but also of young persons alike. It must be clear from our point of view that not only specific needs are recognized and documented, but also that necessary measures are being shaped accordingly, and that the relevant groups are involved in planning and implementing the projects as well. So that's also the point that Verity made at the beginning, to include people and listen to them and to listen to their needs. Finally, projects must include gender, age, and disability aspects when deciding on performance indicators and share disaggregated data on these groups. But in addition to the marker, we also funding a variety of targeted measures that specifically focus on older people in humanitarian crisis. So that's the other approach. The first one was about how to being sensible to age aspects. And the second one is how to target age specific needs particularly. So, for example, we are funding a Help Age project in Jordan and in Syria to improve the inclusion access to healthcare for older people. Another example would be a project by the Arbeiter-Samariter-Bund in Ukraine, where we are funding winter aid and access to mental health and psychosocial measures for older people who have been left behind in the conflict zone. And we have just finished another project that we did together with Help Age in Tanzania for the protection of older persons, refugees from Burundi. So as you can see, Germany is doing quite something to ensure that older people are integrated. And of course, we can still learn a lot on how to improve ourselves. And that has been, that's why this meeting today has been so instructive for us. But we also think that there are some obstacles that we can already realize ourselves. Our funding can only be as good as the data that we are receiving. Governments usually do not implement projects themselves. We are dependent on the data that we receive from our partners. We have seen that for some partners, it's more difficult to deliver the data we ask for. This is especially true for disaggregated data. Some organizations also voice data protection issues in this regard. We are working with all of our partners individually to find ways to solve these problems. Sometimes also crisis situations develop and change so fast that accurate information is hard to deliver. In these cases, we are in contact with our partners to try to find flexible and suitable solutions. We also see a need to better include older people in disaster risk reduction. Older people are one of the groups most affected by sudden onset crises and disasters, but as of yet are not represented to the extent they needed to be in the discussion. Consequently, we are currently exploring a potential project with a specialized humanitarian partner. I will leave it with this, Miriam, and I hope this has been useful in order to explain a little bit what we as one of the bigger donors are doing in order to make sure that our projects are age sensitive. Thank you.
Thank you, Pete. It is really interesting to listen to a donor's perspective on this topic and that this issue is something that you're tackling already. Now moving on to Richard Blewett. He is Executive Director of International at the British Red Cross. He previously worked at the International Federation of Red Cross and Red Crescent Societies, where he was head of delegation and permanent representative to the UN. Richard, it is a pleasure having you here. Do you recognize the issues raised in this research from your work with the Red Cross movement? And what solutions or strategies do you see?
Okay, can you hear me, Miriam?
Yes, we can.
Okay, great. Thank you very much. You know, it's inspiring to be on the call. I'm so happy to hear of the marker that the German government have in play and how the partners are trying to, push this agenda forward. So I've come back to the Red Cross movement after a number of years. Some of the strengths of the Red Cross movement that are relating to the aging issue. Number one is we work according to our fundamental principles, particularly the fundamental principle of impartiality. So we work in context irrespective of age, gender, race, ethnicity. And that kind of encourages us and forces us to think about the different groups we're there to work and support with. The second thing is the Red Cross, Red Crescent has a universal footprint. And so we are naturally working on healthy aging in many parts of the world. And so we kind of have a sort of set of programs that relate to older people from many of our national societies in parts of the world, which I think is a good thing. I think then, we've also built into our protection approach the idea of thinking about gender, diversity, inclusion, which includes the sort of last mile marginalized communities, migrants, and kind of older people get somewhat captured in that, but not perfectly. With HelpAge International, our World Disasters Report in 2018 had a chapter on older persons in the context of reaching last mile communities. So we did some global advocacy, I guess, on the issue, which is good. How do we sort of view in the context of our healthy aging idea the engagement with older people? Well, firstly, we want to ensure physical, mental health, psychosocial well-being. We want to address ageism, age-based discrimination and exclusion, promoting intergenerational solidarity and dialogue, and positioning the Red Cross national societies and Red Crescent national societies as advocates for healthy aging. So we're kind of in the context of we are connected to aging in parts of the world, but not all parts of the world. But it gives us, I guess, a natural interest that we have capacity in Geneva, we have capacity in some of the regions to be active in this, both with our national societies and through the IFRC. The next thing I think I would say that in the context of disasters, we have gone some way on engaging communities, signing up to the common humanitarian standards. A good number of our national societies have done that, and that gets us more mindful about community engagement, which gets you to sort of say, well, who are the community and how do you disaggregate that and understand it? There's a bit of technical guidance that we have and a bit of training on older persons in the context of disasters and evacuation. And then we have some training of older persons in the context of supporting them and them being active as volunteers in the areas of first aid, mental health and psychosocial support and disaster management. In the context of course, COVID, we've seen that, like one of the respondents was saying, older people obviously need access to their medicines, and that's been disrupted. And many of our national societies have tried to reduce the level of disruption by bringing medicine and other support to the older persons themselves when they're having to shield and protect themselves. Many of our national societies engage older people as volunteers, so they're part of our workforce. Of course, many older people are active and physically strong and want to contribute. The Red Cross, Red Crescent around the world uses the expertise of older people relating to things like risk communication and engagement in the time of COVID. We recognize that we've got to reach that category of persons effectively, and therefore we've got to know how do they experience COVID and what do they understand by the messaging, etc. So I'm coming towards the end. I mean, so what I would then say is we did a study a bit complementary to Help Age, but a much more modest one of older people and caregivers in the South Caucasus during impact and the impact of COVID. And we had fairly startling and negative data. 47% of older people in the South Caucasus received, some extra financial support, but it was incredibly limited. Older people's health generally deteriorated, including their mental health, spiritual well-being. And 40% of respondents in the region have reported that chronic conditions, their chronic conditions were being deprioritized by the healthcare system. So we kind of are doing advocacy and some level of support to the visibility of the issue there. So towards the end, we came up with some short-term recommendations for ourselves about how we can work with older people in crisis in short term in the context of COVID. Good level of local coordination. So the issue of local actors and local organizations being at the heart of the solution of the humanitarian work. And of course, we know that that's a big journey that is not really well underway in our humanitarian community, but it would help probably getting the issue of older people higher up the agenda because local actors are close to the reality. Secondly, how to support prevention and risk communication to reach older people. And then what I wanted to end with is, we in the British Red Cross, just as one small example, have attention to safe and inclusive minimum actions. So we have to have participation and information sharing as part of any project that we fund. We have to have the basic data, disaggregated data. So that kind of encourages at least some level of engagement. But I want to end by saying, when I sort of read all the things that we've been doing, and then I thought, well, what's the reality in major humanitarian settings? And I kind of am still saying that the glass is pretty half empty. If I look at the Red Cross, Red Crescent, we still can't do very good needs assessment in crisis, let alone disaggregate the data. We actually don't do very good needs assessment. So that's a big problem. And therefore, there isn't disaggregated data. And so I think on the major contexts, that are not the sort of topics of a few people in our structures and a few national societies that do really care about older people, we have a massive journey to bring this into our core DNA in the years to come. Back to you.
Thank you so much for your answer, Richard. It was very insightful to listen how the British Red Cross is addressing this issue and is being proactively advocating for a change, but also your honesty about all the work that is left to be done. And also, you mentioned a very important word and localization, right? That this is key for us to be better humanitarians. So thank you for that. Lastly, I would like to invite Luciana Caffarelli. She's a global gender equality and social inclusion advisor at Christian Aid. She has worked for over 10 years in humanitarian context. Welcome, Luciana. And I would like to ask you, what do you think is working well at Christian Aid?
Hi, everyone. Thank you so much. And thank you to Help Age for inviting me to be part of this panel. So I think there are a few things that are working well at Christian Aid, but I think that, like many organisations, we do face many challenges. So firstly, Christian Aid was part of the ADCAP project quite a few years ago. And this really enabled us to create awareness within the organisation on inclusion of older people and also people with disabilities. So we developed tools, we developed an inclusive programming framework, which has 4 pillars. First one is the gender and power analysis. The second one is meaningful participation. Third is do no harm. And fourth is inclusive accountability. And also, this really also led to the establishment of inclusion advisors, so people in positions at the regional level. So I would say that having regional advisors, project officers, project managers on inclusion and gender would be really important, and has been important to Christian Aid to drive internal advocacy and support country offices and projects on trying to mainstream older people, and also to support projects with standalone projects. I think another thing that has worked well, it does work well at Christian Aid, is that we do encourage data collection on older people above 60, and if possible for the data above 60 to be disaggregated. So currently the format we use to record the direct number of people our programs reach is 60 to 79 and then 80 plus. But however, we do realise that we've still got a long way to go to get this done consistently, but we do always advocate for sex, age and disability disaggregated data. I think one challenge we have with this is that the donors' age brackets can vary quite differently, and so it can be difficult to aggregate this data at the end of the for reporting and for the end of the year. I think, but also I guess for Christian Aid and our own funding, we can disaggregate above 60. So we have our own appeals money and we have a proposal template. And so for that, we're able to disaggregate above 60. I think a third thing that works quite well is maybe if we're successful at winning disability inclusion projects in a number of countries, then I think we've seen that we're able to target a lot more older people. As Verity mentioned in her presentation, 40% of older people in that particular research had at least one disability. So in some ways we're targeting more people through disability inclusion projects. I think maybe the last thing I'd probably come to say is that we look at our language and the language we use. So we use language such as reaching the most marginalized or the most left behind, which can generate a discussion around, well, who is that? You know, which people are we talking about? So we tend to see that older people come up as well as people with disabilities, and we tend to use an intersectional approach to our programming. And I think this helps us then to target older people. However, I would say we do still face real challenges, and this is more on the sort of what I'd call our sort of second pillar of our inclusive programming framework, which is around meaningful access, meaningful participation, and those specific needs being met. So, for example, often country programs follow guidelines on wash and shelter and nutrition, which are set by the cluster, but they don't always consider the specific needs of older people. So we see that blanket approach taking place as opposed to meeting their individual needs. And I guess probably what I'll end on saying is that we've heard in the presentations around the sort of the no more room for another group and the feeling of being overwhelmed, you know, in country offices and project staff. And I think that is something certainly we feel like is being felt also at Christian Aid. I've also, I think, seen the opposite, and some other people talk about it being part of their role, and it should be, you know, part of what they do. So I think would be good to, I would welcome solutions on how we address that kind of overwhelm and sense of overburden on project staff. So, but I'll leave it there. Thank you.
Thank you, Luciana. That was fascinating, and I think it was a great transition for the next part of this session. We would like to open the floor to the audience. We have around 25 minutes, so please feel free to raise your hand or alternatively use the chat to ask questions to our panelists and respondents. We would be very grateful if you could let us know to whom you're addressing the question. And Ken, if you could help me with any questions from the chat, that would be great.
If you like, Miriam, I can just come in just to kick things off by bringing together two questions that were presented by both Berhanu and Jürgen, which I think are quite closely linked, which is challenging us to think more about how do we approach this situation more systematically across the system. So Berhanu was asking what kind of pragmatic recommendations there are for influencing other actors, and specifically what donors' role they have to play. And Jürgen followed that on by also talking about the failure of the multilateral approaches, that they've been failing older people, how the UN clusters just really haven't been responding in terms of programs or projects, and specifically what role that donors like the German government have to motivate partners and stimulate responses to close these gaps. So it would be good maybe just to get some initial responses and reactions to that.
I don't know who would like to start answering those questions. Any for our panelists or respondents?
Hi, Miriam. I was just trying to put my hand up, but it's failing. So I'm just going to jump in if that's okay. Yeah, I think that, I mean, it's a great question. I think there is a really strong role for the donor community kind of inevitably in this, because I think there are two things. One is, you know, how do we strengthen accountability within the system when it comes to older people? And there are different levels of that I would see. One is at the level of funding and the control, and obviously donors have a huge amount of control there, all of the control almost. And we see great examples, you know, from the German government with the age and gender marker, for example, and really looking, you know, there are others also, some things within the RRF, for example, in the UK, which sits with the FCDO now. So there are good examples out there of donors using their funding mechanisms to try and strengthen attention to older people. There tend to be few and far between, and could probably all of them be strengthened in different ways as well. Nothing's certainly perfect. And then I think the other thing, which I think speaks to Jürgen's question, is going beyond that, how in a much more systematic way could donors as well use their role within the multilateral system, with their multilateral partners in particular, and encourage more leadership and more accountability within that part of the system through the roles they have in their bilateral arrangements, on the kind of governing bodies of the major UN agencies, and through the kind of multilateral, more kind of diplomatic political system as well. There's a huge role to play there, and we do see some good examples of it. You know, not necessarily in relation to older people, but we've seen donors really using that leverage that they have with agencies and through their bilateral arrangements in relation to disability, for example. And we've seen some real strengthening of disability data within the humanitarian needs overviews, for example, because that's something that the UK government has been pushing for in its kind of as a performance indicator almost within the funding arrangements that it has with agencies. So I would sort of echo, I think, the intent of the question, which is that there's a huge amount for donors to do. Obviously, there's still a huge amount for the agencies and for individual NGOs to do as well. And I think Richard was alluding to some challenges. There's huge, obviously, I mean, I think everybody has referred in some way or another to challenges in relation to data. HelpAge is about to start a piece of work on really trying to unpick and unravel what we can, how we can try and push past this, kind of really look at the humanitarian data ecosystem as a whole and really identify what's going to make the biggest difference. But certainly there's a lot we need to do at the level of, you know, strengthening even just individual needs assessments. And I should also say that, you know, HelpAge is here. We do our own needs assessments. We can run those in emergencies. That's what our research was based on. But also we are very happy to provide advice and support around how to capture older people's needs. I think I'll stop there, but maybe what I will do is just throw out a question or a point which I think I've seen just coming up and to be referred to by a few different speakers, is this question of overwhelm and how do we deal with and address a kind of fragmented inclusion agenda. And I think that's really crucial. And if we can sort of together start to think about solutions to that will yes allow for individual needs of different constituency groups to be addressed, but in the framework of something which is much more coordinated, I think that would help enormously.
Thank you, Verity. Vera, I see your hand is up, so if you want to jump in.
Yes, thank you very much. I wanted to bring up this issue of leadership that Verity was talking about, and I think that's one of the things that we're not seeing in humanitarian responses, leadership from the top. So here I'm thinking about humanitarian coordinators and humanitarian country teams really making a commitment to the inclusion of diverse people, including older people. And I know there are a lot of blindside, and we can talk about inclusion as one. And I know that there's a risk of forgetting some of it, but really thinking about how diverse groups are impacted differently, how they have different capacities and roles to contribute to the response, and how they should be taken into account with also specific programming. And there, one of the things that we're finding in some of the research that we're doing at the moment is that, and I hear what Richard Blewett was saying about the fundamental principles. Unfortunately, impartiality is a principle that's often assumed, and often a passive one than a proactive one. And we're hearing this a lot in our research at the moment. Or we're humanitarian actors. We don't exclude people. Everybody is welcome. Everybody can access the food assistance, the health services. And really, our questions back in interviews is, how do you know? Like, how do you know you're being impartial? And I think for me, that's one of the things that would be the next kind of step is around monitoring and evaluation, and really holding us to account in terms of impartiality. I don't think we are impartial. And one of the things that I found very striking in our conversation today was how many times blanket programming was brought up in the conversation, actually as actively excluding a lot of people, including older people. And I think we really need to rethink about that approach, and we really need to rethink whether we are jeopardizing certain people to cover what we think is a majority of people. But actually, are we really failing when we do that? Are we not being impartial and not really holding those principles up and really implementing them?
Thank you, Veronique. Pete, do you want to jump in?
Yeah, thank you very much for giving me the floor again. I felt a little bit tempted when I read Jürgen's question, because I think it was also directed towards us as one of the representatives from the donor community. But first, I would like to dispute the notion that he's setting up at the beginning of his question, that multilateralism is in crisis. I think the huge response that the international humanitarian system has been able to provide in the framework of the COVID crisis is a clear proof of how much clout and leveraged international effect the international humanitarian system still has. And it is not by chance that we are not only, of course, we are working with lots of different partners. We are working with NGOs. We are working with bigger NGOs, smaller NGOs, but we are also distributing bigger chunks of our money with the humanitarian system, with the international organizations. And we are doing so because we think it's not always bigger projects, sometimes it's smaller projects as well, because by doing so, we think we can really effect some change in the way that the international organizations are spending the money and are effecting aid and assistance on the ground. That's the first point. The second point is, I also would like to make clear that the gender, age and disability marker that we have introduced, and it applies to all our projects, not only in terms of numbers, but also in terms of partners. So it also applies to international organizations. So they have to make sure as well that they provide us data on gender, disability and age. That, of course, we can always try to be better, and we should try to be better, but I think it's also discussions like the one that we are having today that are definitely useful and spreading a message about the needs of older persons. I'm not sure how many representatives we have present today from international organizations. If we have not, we can repeat the event and do it another time again and make sure that the international humanitarian system is there as well. And I think it's lobbying work by organizations like HelpAge and all the others that is definitely making a change as well, is having an impact. Thank you.
Thank you, Pete. Ken, is there any other question in the chat?
We've got lots of questions in the chat, so I'm going to try to pull together a few just to so let's go back to a question that was posed by Axel right at the very beginning, which I think we've responded to, but I think it's important to acknowledge, which was, you know, why are we specifically having this discussion about older people? Wouldn't it be better to take an approach that was focusing more on capacities and expertise to create meaningful participation, using the principle of nothing about us without us? But I'd like to link that to a question that was posed by Chris McGiver later on, which is, are we being and recognizing enough the role that older people are playing in terms of the benefits? So we're framing, we tend to frame our approach to older people solely through a vulnerability lens, but actually are we also thinking about actually how greater inclusion of older people would benefit others around them as well, and what role do they play? So perhaps pushing those two things together, we could hear some responses.
Who would like to ask to answer that question? I don't see any hands up, so.
Can you repeat the first one? Sorry, I noted the one on the role.
The first one I think you've already responded to, but I just wanted to acknowledge, which is why we're specifically focusing on older people. Wouldn't it be better to have a broader approach that was more focused on capacity and expertise and inclusion, I guess, more broadly? But I think you have addressed that, yeah.
I'm happy to go, Miriam, if you want. But just to say, I mean, I think on the framing, and just to add that the participation angle and inclusion generally, including inclusion of older people, that I think is really something that's quite interesting to look at, and how inclusive participation could be a really big step forward, because if you're able to participate in the response, if you're able to be part of needs assessments, of feedback mechanisms and all of that, then there's less chance that you will fall through the cracks. So I think that is a very, very important angle to how we deal with that feeling of being overwhelmed, and really think about what would be strategic. And I think that's what the results group 2 of the IIC is trying to do, is really looking at inclusive, effective participation and accountability to affected people, to try and at least crack some of that issue. On the role of older people and the role they can play, I mean, I think, like I was saying, it was interesting that this is not necessarily one of the worst blindside, I would say, among the aid actors or mainstream aid actors. I think it is recognized that older people can play a role. I think the assumptions around the role they play is maybe that's where it's not quite the right one. And again, it's about you know, trying to, or making sure that older people are able to participate in the response, whether that's needs assessment, whether that's community engagement, consultation, so that understanding of their roles and capacity is there. I don't think they're only looked at as necessarily vulnerable. I think they're either overly looked at in those very traditional role of men who are elders in the community, or very much look like as unable to participate in any type of activity, and that's the middle ground is not quite there, I think. But yeah, I'll leave it there.
Thank you, Veronique. Anyone else? Verity, yeah, I see your hand up.
Hi, Miriam. Yeah, I suppose a few points I would make. One around why we're focusing on older people and why not have a broader approach. I mean, I think we need both. I think a broader, less fragmented approach to inclusion is essential to help all of us. But I have to say, I'm going to be a bit provocative here. My experience of working for an organisation that focuses on older people, not just in the humanitarian space, I have to say, is that when a broader approach is taken, it quite often isn't inclusive of older people, or they're still kind of deprioritised within that broader approach. So we have to maintain some specificity in order to make sure that we are actually addressing those direct needs. And I would love to also have a conversation about, what is underlying that dynamic where, at the point at which we're saying, okay, older people aren't being accounted for, the response that we're getting back is, oh, we don't have enough room for another box, which is what I said in the presentation. One of the people said to us when we were doing our research, and my question is, well, why did you have room for all the other boxes and now it's this box? Because it's always the same dynamic. And I think Richard mentioned some work that that they're doing around ageism and discrimination, and I think we can't underestimate the extent to which that may be driving some of the dynamic around kind of older people's inclusion in humanitarian assistance. And that is a provocative thing to say, because nobody wants to hear that they're discriminating against anyone. But like I said in the presentation, we're 20 years in now with the same findings in the research, so we really have to start to address what's underlying some of this and see how we can move forward. So we do need a level of specificity. Just saying on kind of discrimination and a rights-based approach, I just wanted to absolutely support all of what's been said about needing to recognise older people's roles, and moving away from this kind of binary understanding of either elders, older men leading in the community, or highly vulnerable, non-participatory beneficiary older people. There's obviously a huge spectrum there, but also I am a bit cautious about us trying to reframe around participation, because participation at the centre in a way, because participation is great. We should absolutely recognise it, and we should make the best use of it, and we shouldn't marginalise older people. We shouldn't be kind of creating dynamics where they are being displaced from the traditional roles that they've had within their communities. And support them to maintain their resilience and the roles that they've had. Those roles should not determine the extent to which somebody gets assistance. And I think we whether or not somebody is participating to a degree is irrelevant to some of the conversation we're having about whether or not they have access to the assistance that they need. So, I think we just need to be a bit careful about where we go with the conversation about participation, because that is not, it's absolutely something that we should support, but it shouldn't be the centre of a conversation about the extent to which older people's rights are being upheld in emergencies.
Thank you, Verity. Matt, do you want to add or complement that answer?
Yes, complement, and I'll be quick. I think the first thing I'd say is I think I completely agree with the idea of not just consulting older people, but I think often the consultation is an essential first step toward then understanding and being able to maximize the specific capacities that older people have. I think one of the things that came up in all of our remarks is that too often response is guided by assumptions that are very inaccurate and kind of not reflecting the heterogeneity and the full breadth of experience of older people in these situations. And so I think by far better inclusion in the consultation and the assessment process, that also then allows for this much richer understanding of older people's experience and capacities and skills that then hopefully leads to those being better maximized by the organizations that are responding. And that's come up especially in the work that I've done in Myanmar, for example, where older people were pretty much systematically excluded from livelihood assistance programs that were being implemented for displaced populations in northern Myanmar, despite the fact that many of them, of course, had the capacity and ability to take part in livelihood generation programs, whether it be farming, whether it be raising of livestock or other things, and in fact often had decades of experience in these areas. But overwhelmingly, if not entirely, those sorts of programs were targeting youth exclusively. And so I think that is one of the ones, and Verity said, it can be difficult to talk about, but where it really does blend into outright discrimination in not thinking that older people are appropriate recipients of something like livelihood programming. And the last thing I'll say is that, and it goes back to, I agree very much with Verity that I think there is a need for specificity here, in that, when without it, I think too often older people continue to get left behind. But I think one potential, partial step in the right direction is when donors are, targeting programs to other groups, whether it be, for example, women or persons with disability, demanding an intersectional focus to those sorts of programming and response. Because all too often, again, at least in the places where we have looked at this closely, funding for disability programming, has had a real impact, as Verity described, from the ways that FCDO has made that a priority. But too often it is just then reaching younger people with disabilities, and in particular younger men with disabilities. And so I think making sure that donors are being far more intersectional in disability programming to ensure that that includes both older and younger people with disabilities. And likewise for programming that is targeting women, it's not really succeeding in reaching women if it's only ultimately getting to younger women, or if only younger women are being included in the way that programs are designed and implemented. And so again, I think it doesn't get us all the way there, but donors being far more intersectional in their response to other parts of the population could certainly play a key role in better responding to the rights of older people as well. Thanks.
Thank you, Matt. I think that we have time for one last question. Ken, is there anything else that we should?
So one very specific thing that hasn't been addressed yet, and this was posed by Baranu again, which is that to what extent does the localization of aid provide an opportunity for beginning to address some of these issues? Or is it just a challenge?
I can start. Miriam, I think it's an opportunity and a challenge, as probably is the kind of standard answer for a question like that. I think there are opportunities, of course, if we're working through local actors, they will be best in touch with kind of local communities and local needs. Having said that, I think we also have potentially a similar dynamic that may play out at local level that we already have at the global level, which is a kind of the relative size of organisations who are kind of representative organisations of older people's associations or civil society organisations. It's not as well developed as, say, a gender movement or even the disability movement, which also has its challenges. And then across all of those groups, whether it's older people, women, or people with disabilities, the access of local actors to the coordination mechanisms and just the systems in place at local level are very limited. I mean, they're limited for local actors overall, but for those groups who are representing specific constituency groups, it's even further limited. So I think it brings with it opportunities, but a whole host of additional challenges. And I think what would be really helpful would be to see more of an inclusion lens on the localization debate that's very much happening at the moment and has been happening for a number of years, but the connection hasn't been very closely made, I think, between inclusion and localization yet, and that understanding isn't there, and those challenges aren't being addressed as comprehensively as they could. Thanks.
Thank you. Vera, I think that you want to add something.
No, I completely agree with Verity, and I was going to say that I think that conversation is starting now a bit more, it has been, you know, a little bit like what we've experienced generally about different groups and inclusion generally in the sector, that women's rights organizations and women's led organizations have been very much prominent in that conversation on localization. And I agree with Verity that it's time for us to really consider some of those other dynamics within the localization conversations around older people's associations, and similarly with organizations of people with disabilities. These are organizations that tend to also be marginalized and reflect similar issues of exclusion in society. So ageism and ableism also affects who we consider as legitimate organizations in that space. And I think it is quite powerful, and one of the work that I think HelpAge does very well and that is quite transformative is supporting older people's associations, their formation, their capacity, and that is potentially very transformative for how older people are being supported in crisis. It's not enough. Everybody needs to play their role, but it is a very important aspect of it.
Thank you, Veronique. I think that we're reaching the last part of the session, which is the conclusion. And I just want to thank you so much for all your questions, answers, comments, and contributions. Today, we have listened from international organizations, a global think tank, donors about the different and complex challenges the humanitarian system has in respecting and upholding older people's rights in emergencies. I think that this is something that should concern all of us as humanitarians. And this session is an invitation for us to reassess what is our role to make that change happen. So the question is what to do now. And I think that we have learned the power of listening and the need to talk with older people. This is paramount to avoid mistaken assumptions that lead us to inefficient humanitarian responses. We also need to improve data collection, analysis, and disaggregation on the basis of age. And I think this is key to guarantee humanitarian principles. We also need to take responsibility for responding to the rights and needs of older people. And we need to remember that we as humanitarians are at the service of others. And our response needs to be accountable, dignified, and coherent to the needs of the communities we aim to serve, not our own understanding of what we think is best for them. And older people's needs should be at the core of our work. So thank you to all our panelists, our respondents, our organizers, and the audience that joined today. We have finished the session now.
Thanks, everyone.
Thank you a lot. Thank you.